This week, Ontario's health minister said all options were being considered to help deal with staffing shortages in healthcare and wouldn't rule out privatizing more parts of the province's healthcare system. Joining me now from Ottawa to talk about what that would mean for patients and workers, what it would mean for you, is pediatric emergency room physician Dr. Anne-Marie Mediwake. Doctor, good to have you on the show.
Thanks for having me, Lindsey.
So how would a partially privatized healthcare system in Ontario potentially work?
It's hard to say exactly what's been proposed because the comments have been so vague. Whenever we talk about privatization, there's two main aspects to consider. One is private pay, so that would be if patients were to pay out of pocket or have private insurance cover care. And that right now is not permitted in the country due to Canada Health Act. The other potential aspect of privatization is private delivery of services. So we do have this largely existing in Canada right now. I'm not a government employee, I'm technically an independent contractor. However, if we move towards more contracting out to private facilities that are investor owned and are for profit, that is a big shift from how most healthcare is delivered in Canada right now.
So the big issue that we're obviously talking about, the reality is there's staff shortages. Earlier this week, Ontario Premier Doug Ford said, quote, "If there were 5,000 nurses that could fly from the sky, we'd be hiring them tomorrow." Do you think privatization could help resolve the staffing crunch?
If anything, privatization will probably worsen that staffing crunch. We have a very limited number of healthcare providers like doctors and nurses in Canada. If we start pulling them out of our public system to staff these private for-profit clinics, we're essentially going to have less people to care for the majority of patients who rely on the public system. So privatization is not a solution. If anything, it'll probably worsen the existing problems.
You know, you've heard the proponents of the private healthcare argue it gives more patients or gives patients more choice. They can take the pressure off the publicly funded system by creating this separate stream of care. And when you hear that, what do you think?
I would like for them to tell me where they're going to find people to staff these clinics and to staff these things, because right now the only option I can think of is to draw away doctors and nurses who are working hard in the public system. So this whole idea of taking pressure off makes absolutely no sense unless you're suddenly able to find those extra 5,000 nurses. Truthfully, I think that it's a shame that we're looking into this tired argument for privatization, which has not been shown to be very effective and to solve these problems. We really should be spending our time and energies on other potential possible solutions, like reorganizing the way we deliver care or paying nurses appropriately. I'm not a nurse, so I don't want to speak on behalf of my colleagues, but from what I've heard, they feel like they'd be able to induce more workers or more nurses to come back to work if they're able to have more appropriate pay.
So you think that's the biggest solution, more money?
I think more money is part of the solution, but there's a lot of things we can do with how we organize care where we hardly need to spend an extra cent. One thing that's been shown to be effective is to have centralized referral lists. Instead of having individual physicians referring to individual consultants, you refer to a whole group of consultants so patients can be seen by whoever is available first. So this is an actual evidence-based way to address some of the problems we've been having with, say, surgical or specialist wait times.
Dr. Anne-Marie Mediwake, thank you very much for your time today.
Thanks for having me.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.